Good afternoon and welcome to bill hearings for the House Health and Government Operations Committee. I'm your chairman, Jocelyn Peña-Melnick, joined by my vice chair to the left, my amazing vice chair, Bonnie Collison. Today we have my amazing legal scholar that I love, Erin Hopwood, to the right. And I do have a shadow today. You want to get up, please? What is your name?
My name is Fabiola.
Fabiola is my shadow today, all right? And they have a program today with the, it's actually Chair C.T. Wilson brings kids every year from the foster care program, and they're here today, so welcome. And I also have this, will you get up, please, say your name?
My name is Corey.
And whose shadow are you? Delegate Taveras. And then I believe, Delegate Johnson. Delegate Johnson, sorry. Delegate Simpson, you have a shadow today too from the program. What is the name? Jaden. Jaden, welcome. And Delegate Taveras. All right. Delegate Taveras, do you have a shadow? Do you have a shadow? And Delegate Taveras has a shadow. Will you please introduce yourself on the same program? What is your name?
Hi, everybody. My name is Samira. I'm shadowing Ms. Megan Taveras today. I'm from Richmond County.
Wonderful.
What district? District 21.
All right. So anyway, I want to welcome these amazing young people, right? There's a saying that says that you can't be what you can't see. So we are all role models for these amazing minds, right? So welcome to the committee, and you're welcome here anytime. So I'm going to go just quickly through some rules. This is basically most of these bills are Senate cross files of previously heard House bills. So they're sponsor only. To the committee, you have heard them already, okay? To the senators, let us know if it's in the same posture as well, all right? And the public has actually been able to submit some written testimony for these bills. For the committee, if you're going to ask a question, please adhere to our usual rules of one question, okay? Your best question. The public is able to see us today on live stream on the Maryland General Assembly website and YouTube. And we're going to start with the first senator that I saw, which was someone that used to be on this committee, Senator Lewis Young, Senate Bill 156, Work Group on Universal Newborn Nurse Home Visiting Service Establishment. Good afternoon.
Good afternoon. Good to see you, Madam Chair.
Nice to be seen.
Madam Vice Chair, committee members. I have a bill, Universal Newborn Nurse Home Visiting Services. It is SB 156. It is a cross-file of the House Bill 334, sponsored by Delegate Kerr. The two bills are not currently in the same posture. The differences are very minor, and the Senate agrees to conform to the House bill. Thank you very much.
Testimony. Are there any questions for the senator? Seeing none, thank you, Senator, and thank you for working with our House sponsor. This concludes the bill hearing on Senate Bill 156. Next, I have Senate Bill 163, Senator Washington, Health General Articles References to Mental Health. Because this is not actually wasn't crossed, I believe. Do you have a panel? Is there anyone with you? Okay. You can get started. And after Senator Washington, I have Senator Ellis, followed by Senator Augustine, then Hershey, then Simon Ayer, okay? Good afternoon.
Great, thank you. Thank you, colleagues. Always good to be in HGO. For the record, Senator Mary Washington. What this bill does is it updates our health code to replace the outdated references to mental health hygiene with mental health, and is to align our laws with modern terminology and understandings. And you know the importance of language in shaping our views and in connotations, and you probably are also well aware, given that this committee's sphere of influence, that historically mental hygiene arose as a part of a movement to improve conditions in asylums and to advocate for mental wellness. However, over time it has become a euphemism to obscure the realities of mental health. The challenges, it's served to reinforce stigma instead of fostering understanding. So for many, mental hygiene evokes the stigma, even derogatory notions, implying something akin to an unclean mind. Advocates brought this bill to me to ask that we have a straightforward solution of replacing mental health hygiene with mental health, and that we do this in our health code as well as our regulations. Okay. The bill was amended to extend the date that the Maryland Department of Health must review and update regulations. You know, as usual, there's pushback on those types of things, but we felt like this was reasonable. And also per their request in their letter of information, we did not, however, there was an additional amendment that required the department to update all its public-facing electronic materials as soon as possible. So in exchange for extending the date for the printed version, I further amended it to say, okay, but anything that's digital, please do that. Anything that's public-facing, please do that. So if it doesn't involve ink, and you can, or if you're producing new materials, that it has this change. In closing, you could just say that SB 163 is about words, but from the constituents interested in this legislation and their families, it's really about dignity, clarity, and also creating a Maryland that meets people where they are with respect. So thank you for your time and attention. I respectfully request a favorable report, and I'm here to answer any questions you might have.
Are there any questions for the Senator? Vice Chair Collison.
Thank you, Madam Chair. Welcome, Senator. Did you incorporate the Health Department's amendments in your amendments?
The amendment that I incorporated was an extension of the date. I'm not aware of another amendment. If you could, if there's another one, I'm happy to.
We can talk about it. I don't have it.
Yeah, you're fine.
No,
Yeah.
It's fine?
that's done.
Okay.
Yeah,
it's done.
that was my understanding. And then
Okay.
I did an additional one to say, okay, we're not delaying implementation when it comes to digital formats or new materials that are
Got
produced.
it. Thank you.
Thank you. And there's no fiscal note, correct?
I didn't put one in.
No? That is music to our ears.
It's, you know, it costs a little bit. It costs some.
There's actually, it can be done with assistant resources. So
Yes.
thank you, everyone. There's no questions. Thank you, Senator, for being with us.
All right,
This
thank you
actually
all.
concludes the bill hearing on Senate Bill 163.
Thank you.
I want to take a minute to thank our committee. Thank you for being on time. I have 21 out of my 24 members. I have a couple that are in the Senate. So I want to say thank you so much for taking, for being on time. I so much appreciate you. Next, we have Senator Ellis, which is actually, you have two bills. We're going to start first with Senate Bill 94, followed by Senate Bill 594. Senate Bill 94 is Maryland Medical Assistance Program, Maternal Health Self-Measure Blood Pressure Monitoring. Good afternoon, Senator. How are you?
I'm quite well, Chair and Vice Chair, members of committee. Senator Arthur Ellis, District 28, Charles County, here to present Senate Bill, which is 94, which is an exact same posture as House Bill 553. I want to thank Delegate Tavares for working with me with this bill to get it through, and request a favorable report on Senate Bill 94.
Excellent. Any questions?
On Senate Bill 94, same posture. Seeing none, thank you so much. This concludes the bill hearing on Senate Bill 94. Next, we have Senate Bill 594, Public Health Use of Opioid Restitution Fund and Training under the Overdose Response Program. Senator?
Chairs, Vice Chair, members of the committee, Senator Arthur Ellis, District 28, Charles County, here to present Senate Bill 594, which is exact postures House Bill 729. I want to thank Delegate Rosenberg, who's not on this committee, I believe. Oh, there you are, okay. For working with me with this bill, and request a favorable report on Senate Bill, what's this number?
594.
594. I forgot my glasses.
It's okay. That happens to all of us, right? After a while, they all become the same. So are there any questions for this bill that is in the same posture? Seeing none, thank you so much, Senator, for working with our House sponsor. This actually
Appreciate it. Thank you.
concludes the bill hearing on Senate Bill 594. Have a blessed day. Next, we have Senator Augustine. We have two bills for you, Senate Bill 589 and Senate Bill 684. We will start with 589, Opioid Restitution Fund Interactive Dashboard. Good afternoon, Senator.
Thank you, Madam Chair Peña-Melnick, Vice Chair Cullison, members of the committee. Senator Malcolm Augustine here asking for a favorable report on Senate Bill 589, which is in the same posture as House Bill 798 that was sponsored by Delegate Lehman that was passed by this committee. I want to ask for a favorable report on Senate Bill 589.
Thank you, Senator. Are there questions for Senate Bill 589? Seeing none, thank you so much. This concludes the bill hearing on Senate Bill 589. We will now go to Senate Bill 684, Public Health Equity Dashboard. Senator.
Thank you, Madam Chair Peña-Melnick, Vice Chair Cullison, members of the committee. Senator Malcolm Augustine here on behalf of Senate Bill 684, which is in a similar posture. This is maybe a first for me with you all. Most always we work so well together that they're always in the same posture, but in this instance it is similar to House Bill 1100, sponsored by Delegate White Holland, who just really grateful for her leadership on that. Madam Chair, the differences between the two is that in Section 135501A2, that's where there were the descriptions of the health indicator components of this dashboard. And under Roman numeral 4, the Senate version has the word abuse, and your committee did the right thing, changing that to, it was for substance abuse, and your committee did the right thing, changing that to substance use. And that makes sense to me, and I understand why that should be a change to the posture of House Bill 1100. Senate Bill 684 does not include A2 Roman numeral number 8, which incorporates body mass index into the list of indicators. Beyond the health insurance access, which is also in that list of indicators, each indicator references a specific condition for which there are documented health disparities that this dashboard will highlight. BMI is an important risk factor for certain health conditions, but unlike the other required components, it is not an associated condition in and of itself. Further, as an indicator, BMI does not distinguish between muscle and fat. It only considers weight and height without differentiating between muscle and fat mass. This can lead to misclassifying individuals with high muscle mass as overweight or obese. Not all obesity is the same. Excessive weight in the midsection more strongly correlates with health risks than in other parts of the body. Now, I know that and been in touch with the department. They have this information. They can include the BMI. That's not an issue. The challenge is with putting BMI in statute is that if a better indicator for the health risks associated with obesity is developed, the dashboard will have to continue to display the information unless there is a statutory change. It's a real issue as there is only so much room on a web page or anything where we find ourselves to communicate effectively. If the BMI language is struck, it would not preclude the department from including it because we do have the provision that allows for that down in the bill. So Chair Peña-Melnick, I ask you consider my testimony when you all deliberate, and I ask for a favorable report with amendment on Senate Bill 684.
Okay. Thank you, Senator. Are there any questions? I see Delegate Morgan. Yes.
Thank you, Madam Chair. Good to see you, Senator.
Good to see you.
Hey, I kind of remember this bill from one of the House version. I know it got amended in the floor to include that BMI indicator. But I was under the impression as how the bill was drafted and submitted that dashboard didn't really include anything that was really controlled by the individual. Is that correct? What are you measuring exactly in the dashboard if you're not going to include information that people can control themselves?
The dashboard seeks to help to give us information about health equity and to make it clear and easy for us to understand disparities that exist, disaggregated, obviously by race, ethnicity, and gender. What we know is that we have different health outcomes for different groups of people, and we need to be able to identify that. We need to be able to see that in order to address that. Because we want everybody to be healthy, obviously. We all have a universal desire to do that. But that is simply not the case. We need to be able to identify those places where we have inconsistency in the way that people are, where people
Well,
are.
I'm just thinking from just a practical perspective. Wouldn't a group of overweight Caucasians have a poorer outcome than a group of name another race? Because when you sit there and talk about health choices, much as the health choices that we face are not inherited through our gender and our race, it's choices that we make every single day.
The data are clear that race, ethnicity, and gender the data are clear that they do have a discernible impact on these outcomes. It's important that we measure them. They also are moving, they are fluid, because we have efforts to reduce those differences that are there. That is the work that this hopes to uplift, so that we're able to get those better health outcomes for all Marylanders.
Maybe I'm just not understanding the legislation, because it seems like you want to chart one specific type of health outcome without considering individual choice in it at all, because that's not in the bill.
Because it's not about choice. It is about identifying the places where there are disparities. That's the purpose for the bill, is to make sure that we have visibility to these health disparities. And that is the purpose for the bill.
I won't belabor the point. Thank you, Madam Chair.
Vice Chair Collison.
Thank you, Madam Chair. Thank you, Senator. So good to see you.
Good to see you too.
So in instances where there are food deserts and people are relying on what's in the local 7-Eleven.
Yes.
And they're eating a lot of chips and dip and whatever they can get there. So could we learn in this dashboard about those food deserts by virtue of high BMIs in particular areas where, I understand the delegates' issue around choice, and I certainly am a victim of my own choices, but I have lots of choices, and I think in instances where you have limited food choices, that you may, it may have a greater impact on you. And the dashboard will help us to understand that.
Thank you, Vice Chair Collison. The answer I would share with you would be that we could learn from that. The only thing, and you're absolutely right that we could. The only thing that I was trying to suggest is that the list that we currently have is really associated with a condition, a disease, and is seeking to identify those disparities versus, which would be important, it's important to understand information about BMI for certain and the impacts that it would have, but that the disparity in the outcome, the BMI, the obesity, would contribute to the cardiovascular disease and what we are seeing as being the concern with the cardiovascular disease, which we are identifying. I would also just share, Madam Vice Chair, that we have an additional portion here where it says any other health indicators determined relevant by the department, which would give them the flexibility to say, if BMI was one of those indicators that we really wanted to focus on and we wanted to have high up, that it would be on that dashboard. They have the flexibility to do that. I am just suggesting that the BMI, because it is not necessarily a condition, that maybe it should fit more into the space that allows for the department to determine if what you said, given your scenario, that it make more sense for that to then be included, but that they should have the flexibility to do so because it's not a condition in as much as it is a part of the underlying risk factors.
I think we're exactly on the same page.
Yeah.
I just
Of course we are.
I just feel like sometimes people don't have equal choices.
I
ultimately.
100%
Right.
agree with you. You know that I do.
Right.
I'm just
Right.
I'm just thinking about this as it relates as well, Madam Vice Chair, to where we put things into statute, and then when we don't see something that we want, and then the administrator says, well, I couldn't do it, because I've experienced that. I couldn't do it because I had to put BMI. And that's the only thing that I'm saying with that,
Okay.
is that's all.
Thank you,
So I
Senator.
have Delegate Chisholm, and then I saw Hill. Delegate Chisholm,
Thank you, Madam Chair.
my pleasure.
But I think you would agree, though, that when we talk about BMI, it's one of the key indicators for type 2 diabetes. Type 1 is hereditary. Type 2 is certainly about choices, as she said. And I think that the BMI is a key component to, I mean, you could even look by zip code then. If there are certain zip codes that are higher in BMI for whatever food deserts, whatever the reason might be, they have a much greater chance across all races of getting type 2 diabetes.
Yes.
So I think that, without that amendment that was added in the House, I think if we're not going to have it on the dashboard, if I understand what you're saying, you don't think we need to have it on the dashboard right now, I think we're missing a key component.
No, sir, that's not what I was suggesting. I wasn't suggesting that. What I was suggesting is that we have identified here key conditions that we want to be sure that we are getting the health disparity data on, and we want to make sure that it's clear and easily visible. And we also provide flexibility to the department if they were to determine additional elements that would also be important to be put into place. That may well include body mass index. It might. The only reason why, and I'm not meaning to belabor the point, forgive me, Madam Chair, I really am not. The only thing that I'm suggesting here is that body mass index is a risk factor and not a health outcome or condition. It is not cardiovascular disease. It is that if you have this, like you mentioned, a higher BMI, there is a stronger probability that you would have diabetes, right? But the question is, what I'm sharing is, it's about the diabetes. And
I
then these are
understand
risk
that.
factors, that's all.
I understand that, but I think we were looking, the point of the dashboard, as I understand it, is to figure out the drivers. What's driving these chronic diseases? What's bringing us to the chronic diseases? And Delegate Collison's correct. You know, processed food's horrible for you, so you're going to have a higher BMI because you can't get healthier food or whatever it might be. So I guess I'm just trying to wrap my head around what's the point of the dashboard, not just saying, okay, we have a lot of heart disease in this demographic, but we don't know but we don't really care what the driver is, because I think we missed the point then. We want to recognize drivers that are causing chronic diseases and then addressing it from there, not just saying, well, we have a huge problem with cardiovascular disease in this race, in this zip code, in this area, without really getting at why. Why? You can't fix anything until we know the why, not just identifying it, but how do we fix it? And we can fix it if we stop this driver, is kind of my point on the dashboard. And we're on the same page. I think we're just kind of disagreeing about exactly what should be on that page. But thank you, Madam Chair.
Thank you, Madam Chair. Thank you, Senator, for the bill. As I understand it, and this is a isn't that so question, as I understand it, the primary purpose, isn't that so? The primary purpose of this is not to get to the underlying causes, it's just to actually have under public, where do we see disparities?
Yes.
Okay. And the other things that are here are yes, no. Do you have health insurance? Yes, no. Do you have cardiovascular disease? Yes, no. Chronic disease? Yes, no. Not what degree of cardiovascular disease, not is it hypertension or whatever. It's just you either have it or, is there a disparity there? Is there a disparity by gender? Is there a disparity by race? We're just trying to see it, so as other places and in other ways we try to address them, we can publicly state and see if we're making progress or if we're not. And that you are not saying don't include BMI. What you are saying is don't put it in statute.
Yes.
All right, thank you.
Okay. I don't see any other questions. Senator, you will be okay, right?
What do you
I mean,
mean?
if
Of
it
course.
stays in, right?
Of course you know that's the
Because
case.
this is what happened. We accepted it
I
on the
know.
floor as a friendly amendment.
Yes.
Our word is our bond.
Understood.
We did call the department, and the department
They said they
stated
could
that
do
they
it.
can work with it.
Yes.
Especially because you have that other provision that says that they can look at other things
Of
as
course.
well. So,
Madam Chair, of course, but of course, all of that, as I hope that my preamble sort of said some of that, but I
Yes.
still thought that it was important for me to make
Absolutely.
the case. But
Absolutely.
of course, I mean, the will of the committee is always just so well informed, and so I'm just very grateful.
thank
for
you.
it.
No,
Okay.
and here, and as I tell our members, you know, my colleagues, this is a safe space. We're supposed to discuss it here and come up with the best policy, right? There's no
That's it.
judgment. So it's always welcome.
Absolutely.
And thank you. And thank you
Thank
for
you.
working with the amazing Delegate White Holland, who is really, really, really an amazing legislator.
I agree 100%.
All right.
Thank you very much.
And I believe that you only had those two.
That was it for today.
And yes, so this actually concludes the bill hearing on on Senate Bill 684. Have a blessed day. Next, I saw Senator Hershey. And that is actually, the bill is Senate Bill 981, Hospitals, Financial Assistance and Collection of Debt Policies. Welcome, Senator Hershey. How are you?
I'm doing well, Madam Chair. Thank you very much. Madam
Good to
Vice
see
Chair,
you.
members of the committee, for the record, Senator Steve Hershey to present Senate Bill 981, which is in the same posture as House Bill 268, which passed this committee unanimously. I want to thank Delegate Charkoudian and the members of this committee that put on some amendments that the Senate Finance Committee enthusiastically accepted. So it is now in the same posture as the bill that you had sent to the Senate.
Thank you so much, Senator, and thank you for working with our House member. Are there any questions for Senator Hershey on a bill that is in the same posture? Seeing none, thank you,
Chair.
Senator Hershey, and thank you, everyone that's waiting. Thank you for your patience, okay?
Madam Chair, can I have 1 minute to
Yes.
introduce? I do not have a shadow with me, but I do have a number of friends that have joined me. My professional work colleague, Melissa, is here with her 3 sons, Quentin, Owen, and Ashton, and they have been on a 5-state tour of colleges, universities, and academies today. So he's out looking at colleges, and just wanted to thank them for joining me up here today, and thank you for recognizing them.
Well, you're with an amazing senator, and you're always welcome in the Health and Government Operations Committee, and I wish you many blessings that you end up in the right college, okay?
Thank you very much, Madam
You're
Chair.
welcome.
Thank you all.
You're welcome. Have a blessed day. This concludes the bill hearing on Senate Bill 981. Next, I saw Senator Simon Ayer, and then Senator Love. Good afternoon, Senator. How are you? And this is Senate Bill 157, Maryland Disability Service Animal Program established. Good afternoon, Senator.
Good afternoon. It's nice to be here. This is an identical cross-file of House Bill 384 with Delegate Lehman, but the asterisk is we're working on an amendment to bring the fiscal note down. So we can't deal with the fiscal note as is. I talked with the chair of the appropriations, and he says the fiscal note is what it is, whether you agree with it or not. So we're working to bring it down. What the fiscal note assumed was we were going to create this program just like the veterans program that's been in law for 8 years, and it's been expanded several times, and the same funding. The intention was to start it small like we did with the veterans program, which cost much less, didn't have any staff added. So we're working on some amendments on that. One, to reduce the amount of funding that is allocated, also minimize the department's responsibilities, and then bring it down to a reasonable amount. So that amendment has been requested, and we will share that with you as soon as it is back from drafting.
And I appreciate that because we do have the bill, but we did not move it because, as you know, our fiscal note was 75,000.
Right.
And I understand the Senate is a little higher, and this was a lot higher than what I'm allowed. So if you're able to fix it, that will be wonderful, and then we're able to move both bills.
Yes, and that would be my goal, to move both bills, and we'll make sure it gets out of the Rules
Because,
Committee.
as you know, this committee is very supportive of the disability community, right?
Yeah, and we're just looking for a chance. We did a wonderful job with the veterans program, and so many veterans have helped And I know we can do a good job with helping those with disabilities if we have the opportunity.
And thank you for your leadership. Really appreciate it.
Thank you so much.
Are there any questions for the senator? Seeing none, thank you, Senator. You have a blessed afternoon. This concludes the bill hearing on Senate Bill 157. Next, we have Senator Love, Senate Bill 349, and she used to be one of us in this House, so she's always welcome. It's medical debt, complaints for money judgment, and real property liens. Good afternoon. How are you?
Good afternoon, Madam Chair, Madam Vice Chair. Friends, I'm great. It's so good to see you all. I miss you. I do. Don't tell my Senate colleagues, even though we're on camera, but it's lovely to be here. It's lovely to see you all. As the chair said, I'm here on Senate Bill 349, which is in the exact same posture of House Bill 428, Delegate Embry, which many of you were kind enough to jump on as co-sponsors. So I ask for a favorable report.
Thank you. Are there any questions on a bill that is in the same posture as the House bill? Seeing none, thank you so much, Senator Love. You're welcome here anytime. This concludes the bill hearing on Senate Bill 349. Are there any senators left? All right, so we do have Senate Bill 213, Health, Maternal and Child Health Population Health Improvement Fund use. And remember, if it's in the same posture as the one they left here, just tell us that.
It is in the same posture.
All right.
Good afternoon, Chair Pena-Melnick and members of the committee. We urge a favorable report.
Thank you so much. We love that. Any question on this bill? Seeing none, thank you so much. Excuse me? Oh, your name?
Yes, Jonathan Crom, Executive Director of the HGO.
And we know you, but Delegate Hill wanted your name for the record. She's keeping me honest.
I was following directions too well.
She's keeping me honest. This concludes the bill hearing on Senate Bill 213. Do you have another bill here?
Yes.
Which
Madam
one is
Chair,
it?
229.
Let's take care of that.
Okay.
Senate Bill 229, Health Services Cost Review Commission User Fee Assessment Repeal of Sunset.
Yes, thank you, Madam Chair. This bill is also identical to HB 54. So again, we support and urge a favorable report.
And your name again for Delegate Hill?
And John Crom, Executive Director of the HSCRC.
All right, any question? Seeing none, thank you so much for presenting Senate Bill 229. This actually concludes the bill hearing on Senate Bill 229. And thank you for working with the committee on this and so many other issues. We appreciate you, okay?
Oh, so my pleasure, and really appreciate all of your time and effort.
Thank you. So we're going to go to Senate Bill 222. Who's here for that bill? Public Health, Cannabis Public Health Advisory Council membership. Good afternoon. How are you?
Good afternoon.
Give us your name, and is it in the same posture?
Good afternoon, Chair Pena-Melnick and Vice Chair, members of the committee. For the record, Chrissy Nizer, Motor Vehicle Administrator. I'm here to testify in support of Senate Bill 222. It does have a companion bill, House Bill 46, both passed unanimously in their respective chambers. There's a slight difference on the Senate bill. They added an amendment with an additional member of the council. So this would simply add the Motor Vehicle Administrator or the designee to the Cannabis Council, because we want to make sure that motor vehicle safety aspect is part of that important public health conversation that's happening. The department is really agnostic, and we defer to the committee in terms of whether that additional member that was added through the Senate bill is included or not. With that, I'd ask for your favorable consideration, and happy to answer any questions.
All right, Delegate Bagnall? Okay. I was going to ask you if you were okay with the amendment, but you went ahead and told us. Okay. Thank you. I don't see Delegate Hill.
Yes, thank you. So on the House Bill 46, we made the Maryland Cannabis Administration Executive Director. So that's the same on both bills. You're just asking about that one slot, and you don't care whether we keep it or take it.
Right. So I think there's a difference between the House and the Senate bill in terms of adding that additional membership, and we defer to the committee. And I think the department has some feelings on that, but we defer.
Thank you.
Thank you.
See no other question. Thank you so much.
Thank you.
And thank you for working with us on the bills that affect your department. And when my members reach out, I appreciate the way you guys respond and work with them. Thank you so much.
Thank you.
You have a blessed day. This week actually concludes the bill hearing on Senate Bill 222. We have the last bill of the day, Senate Bill 224, which is the opioid-associated disease prevention and outreach programs, appeals, and membership of standing advisory committee. Who's here for that bill? And if the members can stay after we go down for just 10 seconds for me for an announcement. Okay. Good afternoon.
Good afternoon.
How are you?
I am all right. Hope you all are doing well. For the record, Alyssa Lord, Deputy Secretary, Maryland Department of Health, Behavioral Health Administration. I will keep this brief. This legislation passed unanimously, remains in the same posture, no amendments nor unfavorable testimony by stakeholders, and we respectfully request a favorable report.
Thank you so much. So are there any questions on Senate Bill 224 in the same posture? Seeing none, thank you so much. And I do want to say thank you to you. You and the Department of Health, despite all the changes, worked really hard with all our members on so many bills. You were available at nighttime, Saturday, Sunday, things that people are not going to read about or see. So I want to thank you on behalf of the committee. I want to express our gratitude, okay?
Well, I thank you very much, and it certainly takes a village, and we are grateful for your partnership and collaboration for making sure that Marylanders get excellent behavioral health care and health care overall.
Thank you. So this concludes the bill hearing on Senate Bill 224. Before we go down, I want to welcome our pagers. Do you want to tell us what county, your name and what county you come from? Come up to the table. Come up. You're not shy. Come up. Who's going to join him? You're going to leave him alone? Oh, come on. Go ahead. What is your name? The one in the middle.
Hey, good afternoon. My name is Luke Hartman. I'm from Prince George's County, and my representatives are Senator Benson and Delegate Jazz Lewis.
And Delegate Alston and Andrea Harrison, District 24. Wonderful. Who's next?
Hi, I'm Julian Holloman. I'm from Anne Arundel County. I'm from here in Annapolis, and I go to Broadneck High School.
Welcome, and you have Delegate Bagno and myself that represent, and Chisholm, that represent Anne Arundel. And who's next?
Hi, I'm Joseph Garrison. I'm from Montgomery County, and I go to Poolsville High School.
Wonderful, welcome, okay? So the next three, please, come up. Tell us your name and what school, and if you know your district where you live. Go ahead.
I'm Matthew Rudzinski. I'm from Harford County. I go to Edger High School.
Welcome. You have a very excited representative over there in Delegate Johnson. And Riley, go ahead.
Hello, everyone. My name's Ava Rollage. I go to Marie Shea McDonough High School, and I live in Charles County.
Okay. Thank you. You have great representatives.
Hi, I'm Sophie Saltonfuss. I'm from Queen Anne's County, and I'm homeschooled as well.
And
Queen Anne's County.
Yeah, absolutely. Well, welcome, and I hope you're enjoying your experience, okay? Thank you for being with us. We really appreciate you.
Yeah, thank you so much.
Oh, you are welcome. Can you bring us down, please? This concludes the bill hearings for today.